We've been speaking with Dr. Fineman about the diagnosis of asthma. Now we'd like to turn to treatment. Once you've determined that someone is suffering from asthma, what is the next step? How do you help this person?
Well, first we find out how severe their asthma is. So we classify the asthma intermittent, which means they may not have it all the time, mild, moderate, and severe. So a patient with severe asthma is going to have symptoms every day. They're going to be relatively sick, having a lot of trouble breathing, and they're going to need a lot more intensive therapy than somebody who has mild asthma. A mild asthmatic may have persistent symptoms. They may have coughing, trouble breathing when they're doing activity and things like that, but they may not be having active wheezing symptoms on a daily basis. So I think it really depends on the severity of the asthma. So based on the classification, and we call the mild, moderate, severe, that's the asthma classification, then we determine what therapy. And we have guidelines. The National Institute of Health has some very good guidelines on asthma treatment, and basically they point out that we should direct the therapy at the severity or the classification and try to make sure they're in control. So we start with a lower therapy for somebody with mild asthma, in other words, fewer drugs, and then step up. It's called a step-up therapy. So we step up the therapy in somebody who has severe asthma, and we give them more medications to try to help get them in control. So the first thing we would do is have a bronchodilator. So the bronchodilator therapy opens the airways. It's a very effective tool. It usually works quickly, and we have all asthmatics have a bronchodilator, which we call a reliever. So it's usually an inhaler that they can use. It's a quick reliever, and then whenever they have a flare-up, they can use that. So that's their kind of relieving, or sometimes people call it a rescue inhaler. That's kind of a basic for everybody. So an intermittent asthmatic might just use it once a month or twice a month. Somebody with severe asthma may need it every day. So it just depends. So let's say somebody who has asthma, and they're using their rescue inhaler, their bronchodilator, more than 2 times a week. So if you're needing it more than 2 times a week, that means your asthma is probably not very well controlled. So in somebody who's not well controlled, then we call it persistent asthma. That's when you need to use a daily controlling medication. The best daily controlling medication is an inhaled steroid. So the next thing we would go to would be an inhaled steroid. Now, inhaled steroids are very good medications. They are corticosteroids, which means they help control inflammation, but they're inhaled, and so they work right in the lung, reducing the amount of side effects. And so we really monitor patients for that, but it's a relatively safe type therapy when we use it at the proper dose and people are monitored. So that would be a mild persistent asthmatic. And then if you have somebody who's not controlled with that and still needing their rescue inhaler, their albuterol, then we start adding more treatment on. Some of the treatment we might use would be a long-acting bronchodilator. And there are medications that combine the inhaled steroid with the long-acting medication into one inhaler. We call those combination inhalers. Sometimes we'll use a pill called a leukotriene antagonist, like montelukast. That's another medication that sometimes we'll add on to the controlling medication. And those are basically the main tools we would use, and it depends on the severity. If you have somebody who has more severe asthma, then you might have to use additional type medications.